Hello students, welcome back to Easy Nurse. When nursing education made easy. So again your exam is knocking in your door, right? So don't worry, we Easy Nurse here as well as. So mainly we are dealing with the psychology for the today's session. Okay, so let's start, and in this session I discussed the question paper. Okay, how the question paper will come, like what should be the pattern of the question paper. So based on that I put some important questions and I made prepare a question paper for your upcoming exam. Okay, other than that also I'll give you much more important questions for your exam, that also you need to study, and this question also you need to study. So mainly these questions are based on previous year, so much previous year back's question paper and all important topics. Okay, so let's start about today's session. So first I am going to input the question paper. Okay, so in the long essay you have to write the two long essay. Okay, so there should be like 3, so you have to write it 2. So in this long essay I put like define psychology, explain the scope of psychology with reference to nursing. Next question I put what is motivations and explain the social motives. Next, what is heredity, explain the role of heredity and environment in causing the individual differences. Next, come to the short essay. So short essay it should be 7, so you have to write 7 only. 5 into 7 is equal to 35 marks you have to write from the short essay. So in this I put methods of psychology, explain the characteristics of mentally healthy person, Maslow's need hierarchy theory, types of the conflict and its resolution, emotions and disease. Next, projective technique, and explain the classical conditioning. Okay, so these all are the important short essay I have put here. Now come to the short answer, mid answer 2 marks. Okay, so in this you have to write 10. Okay, so in this I put attention, frustration, eat, short-term memory, mental health, psychological needs of child, illusion, clinical psychology, intelligence quotient or IQ, and then attitude. Okay, so these all are the questions I have said as a question paper. So now let's start for the discussions with the answer. Okay, so first move to the long essay. Obviously, first question, define psychology, explain the scope of psychology with reference to nursing. So what is the psychology? Psychology is nothing but it is a scientific study of the mind and behavior. So mainly it seeks to understand how the people think, feel and the act both individually and in groups. Okay, so how the people they will think as a individually and how they are behaved as a individually and how they are behaving in the group factor, or what should be their expression emotions during the group conflict or during the group behavior. So that is defined as a psychology. Okay, so it's another word you can say psychology explores the mental process like perception, memory as well as the emotions and behavior, what people do and the factors which is mainly influencing them to do that particular behavior, such as biology, environment and experience. So now come to the scope of psychology with reference to nursing. So what are the scope? First is understanding the patient behavior. So in that the nurses often deal with the patients who is mainly reacting differently to the illness, pain and then hospitalization. And also this psychology it's help the nurses understand what the patients is actually needed, the way what they are doing, and considering the factors like anxiety, fear, denial as well as the depression. So this understanding is it's mainly developing through the empathy and through improving the nurse-patient relationship or through the IP or interpersonal relationship. Okay, so this is the understanding patient behavior. Now come to the communication skills. So in this it is effective communication which is a key to the nursing care, and also this psychology it teaches the interpersonal communication, listening and then counseling and enabling nurses for comfort patients, explain procedures and gain their cooperations. Okay, so these all are about the communication skills. Now come to the emotional support and counseling. So in this the patients and families they often need the counseling as well as the emotional support from the healthcare workers, and the knowledge of psychology which is enables the nurses for providing psychological support, reduce their anxiety and and help the patients cope with the stress, grief, and then terminal illness. Now come to the motivation and health promotion. So in this, the nurses, they have to motivate the patients for adopting the healthy behavior, like taking medications, exercising, as well as quit smoking. So psychological theories of the motivations and then behavior, they are mainly changing the help the nurses, influencing the patient's attitude as well as compliance with the treatment. Now come to the managing stress and burnout. So in this, the nurses, they is emotionally demanding. Okay, so psychology, it equips the nurses with stress management and coping the strategies to maintain their own mental health and prevent the burnout. So these all are about scope of psychology with reference to the nursing profession. Now come to the explain the understanding and then growth and development. Okay, so developmental psychology, it's mainly help the healthcare workers to understand, or to the nurses to understand, the physical, emotional, as well as the social stages of human life from infancy till the age group. This knowledge is mainly help the nurses to tailoring in the age as well as developmental levels of the child care, if especially if any kind of the children is admitted in the hospital. Okay, now come to the psychiatric and then mental health nursing. So in this, the mental health settings, the psychology, they are mainly providing the foundations for the understanding the mental illness, their ideas, their thoughts, their therapy techniques, as well as the patient behavior and what they want actually. So nurses, they use mainly the psychological assessment as well as the therapeutic communication for assisting in the treatment. Next is the research and evidence-based practice. So in this, the psychology, it emphasizes the scientific method for studying the psychology or the human behavior. Okay, so the nurses, they're using as a tool the principles in conducting the research, which is mainly helpful for improving the quality of care to the patients, and also it's also helpful for applying the evidence-based nursing practice on the patients. Okay, now next question, that is what is motivation? Explain the social motives. So what is the motivation? Motivation is nothing but it is an intrinsic internal factor which is mainly moving ourselves to do that particular goal. Okay, so that is called motivation in a simple words. But in the psychologically words, the motive which is refers as the internal process which is mainly initiates, which is mainly directs ourselves, and also it sustains the behavior, our emotions towards the achieving a specific goal or the satisfying a need. So whatever you want to achieve, so into this for the direction from internally, you are getting an intrinsic factor. So that factor is known as a motive. Okay, so this motive is often sometimes influenced by the biological drives, sometimes the psychological thoughts, sometimes the emotions, sometimes desires or social factors. As example, for the successful in the life, what is your motivation? Money. So without money, you can't do anything. You can't fulfill your any requirement. You can't fulfill your any desire or whatever. Okay, so for that you need to reach that particular point, and for that you need to do the struggle, and that is the motivation from your side or from yourself. You will get to do the hard work, and then only you will reach that goal, and then only you can earn the money, right? So that is the social that is the intrinsic factor which is called as a motive. Okay, so this motive is mainly helpful for explaining why people they're acting in a certain ways. Okay, because depends on the situation, the people they are acting differently, and the same situation if you put the another people, they are also will act and differently. Okay, so depends on human behavior and depends on the human or the population, it's going to be changing gradually. Okay, now come to the social motive. So what do you mean by the social motive? Social motive is nothing but it is a desire which is mainly gaining from the society. So from the society, which intrinsic factor is like moving yourself from your inside that to do that particular work. So that is the actual meaning of social motive. Okay, so same way, social motive is also an internal drive or the psychological needs which is mainly promoting an individual to for interacting with the others and seek the relationships for the approval or for the recognitions within a social context. Okay, so unlike the basic biological motives like hunger or thirst, social motives, they are mainly learning as well as mainly influencing by the society, culture, and then personal experiences. Okay, so that is the social motive. So in the simple terms, you can say social motive, which is push us to connect, cooperate, compete, or the influence the others in the social situations. Okay, so these all are the critical for the survival and then personal development, because humans are inherently social beings. Okay, so these all are about social motive. Now come to the characteristics of the social motive. So first is learned through socialization. So social motive, it's mainly develops as we grow, as we interact with the family, peers and society. So for example, the desire for the recognition or the achievement often comes from the cultural as well as the educational norms. Okay, so that is the one learned through socialization. So when you are going to experience something in a society or in your personal life, so then only you will get an idea. If you do this in a next time, if you do that in a particular way, so it will be fulfill your desire, right? So that is the learn through socialization, means within your experience you will get to learn. Now come to the goal directed behavior. So this lead a behavior which is aimed on fulfilling your social ideas or the social needs like friendships, belongings as well as the esteem. Now come to the next, that is satisfying social needs. So in this they are mainly helpful for fulfilling the needs of the beyond mere survival, such as self-esteem and approval, social approval and social identity. Next come to the influence by culture and environment. So it's mainly different societies value different social motives. For example, collectivity's culture may emphasize the cooperations, while individuals' cultures may encourage the competitions. Okay, so that is the example for the influence by culture and environment. So obviously, which culture or environment you are growing up, so based on that culture and environment, you will get an idea and you will learning there day by day, right? What to do, how to do, when to do, what is your culture, how to maintain your culture, everything. So that is the influence by culture and environment. Okay, so now come to the next, that is types of social motives. There are several types are there. First is affiliation motive. So in this, the desire from close friendly relationships. So example, making the friends, joining clubs or the seeking companionship. Now come to the achievement motive. So in this, the need to succeed, excel or gain the recognition for the accomplishments. So what is the example for the achievement motive? That is working hard to get a promotions, winning a competitions or earning awards. Now come to the power motive. So power motive is nothing but it is a mainly desire for influencing, lead or have the control over others. So what is the example? Taking the leadership role, persuading the others or making the decisions in a group. Okay, now come to the next, that is intimacy motive. So it's need for the help, the deep and meaningful relationships and then emotional closeness. It's mainly happen in the adult stage. Okay, so that is the intimacy motive. So what is the example? Sharing the personal feelings with a partner or the close friend. Okay, now come to the next, that is approval motive. So in this, the need to be accepted, approved or liked by the others. So what is the example? Like dressing according to the social norms or adjusting behavior to fit within a group. So that is the approval motive. Okay, last is aggression or the dominance motive. So it's nothing but it is asserting the concept in the social hierarchy. So what is the example? Like competing established status or defending one's social position, means they are humiliating the other person by comparing their own position. Okay, so that is under aggression or the dominance motive. So these all are about the types of social motive. Okay, keep it in your mind. First is affiliation motive, achievement motive, then power motive, intimacy motive, next approval motive, and last is aggression or the dominance motive. Now come to the next, that is methods of psychology. So what is the methods of psychology? So there are mainly three. Okay, first is introspection method or the self-observation method, next is a descriptive method, next experimental method, and last is a developmental method. So there are total 4 types of methods of psychology, means how you will assess your psychology. So there are 4 types. Okay, so one by one we'll discuss. First come to the introspection method or the self-observation method. So it's in this kind of introspection means looking on oneself. Okay, or the self observation or the self analysis. So that is called introspection method. Means by yourself only you are assessing yourself, why you are behaving like this, where you have to improve your character, why you have to improve your behavior like this. Okay, next it is a process which involves looking the inward for examining one's own thought as well as emotions. So now come to the descriptive method. So in this descriptive method, what is the actual meaning? So it's mainly the descriptions of the behavior. Okay, so mainly through this descriptive method, we are explaining why the person is behaving like this, which kind of the behavior the person is having. So it's mainly it's done by the some process. Okay, first is observation method. So under the observation method, you can see the naturalistic method. Okay, naturalistic means from the far away you can observe the person and you can see. Next is a laboratory observation. Laboratory observation in the sense like through the laboratory diagnosis, by collecting some blood sample or some other sample from the human body, and we are sending those sample to the labs, and based on that we are checking the hormonal level, and based on that we can concise with the medical science and we can tell why the person is behaving like this. That is one of the method. Okay, that is observation method. Next come to the case studies. Case study in the sense like we are collecting the data and history from the patient and patient's family, and based on that we are analyzing the data, and after that we are like thinking why we are doing the research, why the patient is doing like that. So based on that we are preparing the treatment procedure and we are implementing that. So that is the case study. And last is the survey method. So survey method you can see as a interview method, sometimes it's a telecall method, etc. Okay, so in the interview you can go for the direct interview, or sometimes you can go for the indirect interview or face-to-face interview. Okay, so direct or face-to-face in the sense the questions is already prepared by yourself, and that question only you are asking based on the case study of that particular patients, and that is called direct or face-to-face interview. Other than that, you can observe the patients, and based on the present case scenario you are asking the questions to the patients for getting the data from the patient side. So that is the like indirect as well as the non-prepared interview method. And one more is that is telecall. Okay, so through the internet or through the phone call you can collect the data, and based on that you can do the interview method. So these all are about descriptive method. Now come to the experimental method. So what is this? It is a very powerful design for the testing hypothesis of the cause. Hypothesis in the sense we are searching the reason behind of that particular disease. So that is called hypothesis. When you are doing hypothesis, after collecting all the data, after collections you are doing the like assessment. Okay, so after assessing you are seeing the hypothesis. Okay, so that is called the means you are seeing the what is the reason behind of that. So that is called hypothesis. So you are after testing you are doing the hypothesis of cause and effect relationship between the variables. So in an experiment you can see the researchers manipulate the particular independent behavior or the variable under the control condition and observe the resulting changes in a dependent variable. Suppose the one example, the person is getting the lung cancer due to the excessive smoking. Okay, so here what is the dependent variable? What is the independent variable? That is the lung cancer, right? And what is the dependent variable? That is the smoking. So if the person is quit the smoking, so what will happen? The lung capacity will improve, right? So based on the dependent variable, the independent variable is growing up gradually. Okay, so that is the main thing. So in the experiment, the researchers they are collecting what is the independent variable and what is the dependent variable. Based on that, they are collecting a proper relations. Okay, so assess the effectiveness of deep breathing exercise technique on the stress among cancer patients in a oncology ward of a medical college. So here in this example, what is the independent variable? The independent variable in the sense breathing exercise technique. Okay, and what is the dependent variable? That is the effectiveness of the deep breathing exercise. Okay, so that is the like dependent as well as independent variable, and it's mainly applying on the cancer patient. So if they are doing the during the stress situation, if they are doing deep breathing exercise, so what will happen? Stress will decrease for those particular patients. Okay, so that's why these are called independent and dependent variable. Now come to the next, that is developmental method. So it is a very scientific approach which aims for explaining the development from birth aptitude in the development of the person. So it can be used in a two approaches. First is cross-sectional. Cross-sectional in the sense where the people of different age group, they will be studied simultaneously. So that is the cross-sectional, and last is a longitudinal. So this is the same person or the group, they are studying over a long period of time. So that is the longitudinal method. Okay. Now come to the next question, that is explain the characteristics of mentally healthy person. So when we are considered the person is mentally healthy, when the person will behave properly according to the situation, according to their personal motive as well as motivations, emotion, etc. So that time we can consider the person is mentally healthy, right? So what should be the characteristic? First is self-awareness. They have to understand their own thought, their emotions and behavior, and they also have to recognize their strength and weakness realistically, and also they have to accept themselves without excessive guilt or pride. Okay, so that is the self-awareness. Means when you are behaving something, so behind of your unconscious mind, it should be there what you are doing, okay, what you are speaking, what you are behaving. So that is the self-awareness. Now come to the emotional stability. So in this you have to manage your emotions appropriately, which is does not overreact or suppress feelings. Okay, so that is not a matter. If you overreact, so everyone will blame on you, and if you suppress your feelings or inner side, or you become an introvert, so it will hurt you, right? So for that emotional stability you have to maintain. You always have to be emotionally strong, and also you have to recover from the stress, disappointment as well as failure effectively, and also you have to maintain the inner calm side during the difficulty. So during the difficult period, if you were reacting so much, so it will be problematic for you. So that's why you have to be very calm. Next is a realistic thinking. So in this you have to perceive the life accurately as well as objectively, and it does not distort reality with the excessive pessimism as well as the unrealistic optimism, and you have to make a rational decision based on the facts and logic. Now come to the healthy relationship. So in this you have to form a satisfying and then stable relationship with the other people, and also you have to show the sympathy, understanding and respect for the others, and also you have to balance the dependence and then independence in the relationship. Now come to the self-control. So in this you have to regulate your own impulses, desires and behavior appropriately, and also you have to delay the gratification when necessary and act the respond in various situations. Next is a purpose and direction. So what is this? You have to has a goals, ambitions and sense of a purpose in life. So you have to work very much consistently towards a personal growth and achievement, and also you have to feel like a meaningful and then worth living. Now come to the adaptability. So in this you have to adjust effectively to the life's changes as well as the challenges in any situation, and also you have to cope up well with the stress and uncertainty, and you have to learn from the experience and failures. Now come to the positive self-concept. So in this you have to has a healthy self-esteem and confidence, and you have to value themselves without any arrogance and accept the both strength as well as the limitation. Now come to the inner peace and contentment. So in this you have to experience a sense of a satisfaction and happiness, and you have to maintain the balance between work, rest and recreation, and also you have to appreciate the simple joys in life. Now come to the Maslow's need hierarchy theory. So in this Maslow needs hierarchy theory, which was proposed by the Abraham Maslow in the year of 1943, it is a motivational theory in the psychology which is mainly explaining the human behavior in terms of the hierarchy of the needs. So Maslow, they are suggested that people are motivated to fulfill the basic needs before moving on higher level psychological and then self-fulfillment needs. So first is the physiological needs or the basic needs. First is definition. So these are the most fundamental human needs which is necessary for the survival. So example, food, water, air, shelter, sheep, clothing as well as the reproduction. Now come to the explanation. So until these needs are satisfied, so individuals, they are unlikely to focus on the higher level needs. Now come to the safety level as well as the safety needs or security needs. So what is the definition? When the physiological needs are met, people, they are trying to seek safety and then stability in their environment. Next is the example. So physical safety, protections from the harm, financial security, health security and job stability as well as the safe housing. Now come to the explanation. So in this you have people want to feel secure and free from the danger or any kind of uncertainty. Now come to the esteem needs. So in this they involve the need for self-respect and the respect for the others. Example like achievement, recognition, status, reputations, etc. What is the explanation? When the people feel feel the respected and then competent. They develop the self-concept and self-confidence and feel valued in their own life. Now come to the self-actualization need. So in this is the highest level in the Maslow hierarchy. So this need is realized the one full personal competence or the personal growth. So in example, creativity, problem solving skills, critical thinking skills, morality, pursuing the personal goals, self-fulfillment, etc. So what is the explanation? The self-actualized person seeks the personal development and purpose the beyond material success. Now come to the love and belongingness needs, that is the social needs. Okay, so in this, what is the definitions? Human, they have a strong desire for the social relationship and then emotional connection. So example like a friendship, family intimacy, infection, belongings for the groups or the communities. Next is the explanation. So after achieving the safety, people seek love and acceptance from the others. Now come to the types of conflict and its resolution. So conflict is nothing but it is a disagreement or the clash between individual or the groups due to some kind of differences in opinion, values, needs, thought, interests, etc. So it is a very much normal part for the human populations or human interactions, and it can occur in various sectors, as example work sector, family, schools, communities, etc. So what are the types? First is interpersonal. Interpersonal is nothing but when this conflict occurs within an individual. An example, a person torn between the pursuing a stable job and following their passion. So that is the interpersonal conflict. So resolution, the self-reflection as well as the clarification, seeking counseling or advice and setting the priorities, and based on that they have to take a step. Now come to the interpersonal. Interpersonal is nothing but when this conflict happen between two or more individuals due to the personal thoughts, differences, misunderstanding, competitions, etc. What is the example? Two co-workers arguing over the task responsibility. So what is the resolution? Open communication, finding the common ground or compromise, and using the empathy for the understanding. Now come to the intra-group. So intra-group is nothing but when this conflict is happening within a team or group. So example like team members disagreeing on how to complete a project. So what is the resolution? Establish the clear roles as well as responsibility, open up communication, encourage the collaboration, group discussion, and also use a team leader to mediate or the manage the dispute. Now come to the inter-group conflict. So in this, what is the meaning? That conflict between different groups or departments. So what is the example? Marketing and then sales department, they're disagreeing the strategy. So what is the resolution? They have to promote the intergroup cooperation. They have to focus on the organizational goals rather than group interest, and also they have to use the negotiation or the third party mediation. Now come to the organizational conflict. So what is this conflict? They're arising due to the structural policy or the leadership issues within an organization. So example, employees, they have to opposing a new company policy. What is the resolution? They have to be a transparent communication for the policies, employee independent in decision making, and fair or consistent leadership practices. Now come to the conflict resolution strategy. So first is avoidance. They have to ignore or the withdrawing from to the conflict, and useful when the issue is minor or emotions are high. Now come to the accommodation. So in this, they have to giving a main harmony. So it is useful when the maintaining relationship is more important than the issue. Next is a compromise. So each side gives us something to reach a middle ground sector. So it is useful when the both parties have the equal power in that particular things. Now come to the competition. So it is one party, they pursues its own goals at the expense of others. Okay, so it is mainly useful when it is come to the emergencies or when a quick decision action is needed. Next is the collaboration. So both parties, they work together for finding a win-win solution. So it is the mainly most effective for the long-term relationship as well as the mutual benefit. Now come to the next, that is emotions and disease. So what is the emotion and disease? So first is the emotion. So emotion is nothing but it is a very complex psychological and then physiological states which is involving the three components. What are the three components? Subjective experience, a physiological response, and behavioral expression. So subjective experience in the sense what we are feeling internally, as example sadness, anger, joy. Next physiological, like what is the pulse rate, then heart rate, then hormone release, etc. Next is a behavioral, how we are facing the problem, means how we are expressing, sometimes facial expression, tone, actions, etc. Now come to the major theory of the emotion. First is a James Yang theory. So it is a emotion will result from the physiological reaction for the events. So in that we feel the afraid because we tremble. Next is a Cannon-Burt theory. So emotions and physiological reactions, it's mainly occurred the simultaneously. Next is a Scatcher-Singer or the two-factor theory. So in this the emotions are physiological arousal plus the cognitive interactions. Okay. Next is a Lazar's cognitive appraisal theory. So here emotions depends on how we interpret or appraise our events. So that is the major theories which are related with the emotions. First is James Lang theory, next is a Cannon-Burt theory, Scatter-Singer or the two-factor theory, and next is a Lazarus cognitive appraisal theory. Now come to the functions. So first it's mainly help for the adaptations for the environment, as example fear, to escape and to danger. Next is a guide decision making as well as the social interaction for solving this problem. Next serve as a signal to self and others about the internal access. Now come to the next, that is the links between emotions and disease. What is the links is there? So first is mind body, the mind body connection. So psychology, it's recognized the biopsychological model of the health, which is mainly meaning for the biological, psychological as well as the social factor, which is mainly interacting the influence disease. Okay, so emotions, it can affect various way, like the autonomic nervous system like heart rate, digestion rate, it might be impacted. Endocrine system like hormone level like cortisol and adrenaline might be increased. The immune system, which is defense against the infection and cancer. So when the emotion stress becomes the chronic, these systems can become a dysregulated as well as contribute to the illness. Now come to the negative emotions and then disease. So first is stress, next is depression, third one is the anxiety, next anger and hostility, grief and emotional separations. Now come to the positive emotions and health. If you have a positive emotion, so how your health will be benefited. First, positive emotions like happiness, love, then hope as well as gratitude, which is mainly measurable health benefits like lower blood pressures and then heart rate. Next is a strengthen the immune response, reduce inflammation, faster recovery from the illness or surgery, and next is longer life expectancy. And these practices like mindfulness, gratitude, journaling as well as positive social relation, which is mainly improving your mental as well as the physical well-being. Now come to the next question, that is projective technique. So what do you mean by the projective technique? It is a group of your personality assessment method which is mainly used for the psychology to explore a individual's unconscious thoughts, feelings, desires and conflicts. Okay, so they are based on the projective techniques which state that a person is presented with an ambiguous or the vague stimulus, so their interpretations of the stimulus will reversal aspect of their inner personality, including the hidden emotions, then conflict as well as the motives. Okay, so that is all about projective techniques. So it's nothing but it is a group of the personality assessment methods. So it is mainly reading your psychological as well as the behavioral and then physiological thoughts, and in your unconscious thought, then feelings, desires, etc. So that is the projective technique. So what is the theoretical basis is there behind of that projective hypothesis? First is it was proposed by the Lawrence K. Frank in the year of 1939. So what was the idea? That when the faced with the ambiguous material, then individuals project their own unconscious wishes, fears and then conflict onto the stimulus. Okay, next come to the response, which is reflect the individual personality structure, not the nature of a stimulus itself. Next come to the, for example, if someone sees a random ink bolt as a monster, and it may reflect the internal fears or the anxiety for the person. Okay, so what is the characteristics for the projective technique? First is the ambiguous stimuli. So the test material is very much vague. Okay, so as example, ink blocked or the incomplete sentences. Next is the unstructured response. So the subject, they can respond very much freely, not limited by the predefined options. Next is the reverse unconscious process. Okay, so the response, it should be believed to expose the inner conflict or the desire. Next is the interpersonal interpretations by the expert. So what is this? The response, it should be analyzed qualitatively, sometimes the quantitatively by the trained psychologist. Qualitatively in the sense like how much is the intensity, how much they are getting the anxiety or fear, and when like how it is impacting their physiological as well as psychological health. And now combined quantitatively means how many times they are getting the fear with the same object. Okay, So less faking possible, like since the person that doesn't know about what is being the measured, it reduces the conscious manipulations of the answer. So now come to the types of projective technique. First is the association technique. So what is this? It's mainly participants, they are asking for the associate words, picture or symbols with the other words or the ideas. Okay, so what association test or the WAT you can see, which is developed by the Carl Jung. So the person, they are responding in the each and every word stimulus with the first word that comes to mind. Next come to the use to study emotion and then complexes. Now come to the Rorschach's ink block test, which is the developed by the Herman Rorschach in the year of 1921. So in that they are using the 10 ink block cards, some black and white and some colored. So the subject, they describe what they are seeing, means what the persons they are seeing, and interruption is based on the locations, determines like color, foam, shading, etc., and sometimes due to the content. Now come to the constructing technique. Okay, so in this the participants, they are asking for creating an image, like sometimes story, drawing or situations. So the thematic appreciation test or the TAT, which was developed by the Henry Murray and then Christina Morgan in the year of 1935. So the 30 ambiguous pictures, these repeating the social situations, and the subject there tells a story about each picture. So each picture they are considering as a story which led up to it, what's happening and what the outcome will be after this test, and reveals themes like a needs, drives as well as the conflicts, what is happening inside of their particular persons. Next is the children's appreciation test or the CAT, which is adapted versions of the TAT using a animal finger suitable for the children. Next is the picture story exercise or the PAC. So it's mainly similar to the thematic appreciation test, but also it's used for the motivation research for giving the motivation. Next is a draw a person test or house pre-person test or the HTP. So individuals, they're asking for they draw a certain figures which is interacting with the based on symbolic and then emotional expression in the drawing. So based on the symbol and based on the emotions they are calculating. Okay, so these all are about the types of projective technique. Now come to the completion technique. So in this the participants, they have gave the incomplete task or incomplete sentence, stories and dialogues for asking the finish them. First is the sentence completion test, like as example, my father always dash, I feel happiest when dash. Now come to the responses, which is reflect the attitude towards family, work, relationship and then safe, and example versions like Rotter's incomplete sentence black. Now come to the choice or the ordering technique. So what is happened, the participant, they must choose or the range the items or picture based on their preference or the association. So in this you can see the two types, that is a Zondi test. So the participants, they choose the faces of, they find the like appending for the repulsive. So the choice, it should be interpreted in the terms of unconscious mind or unconscious drive. So color preference test or the like the Lucier color test. So color choice is linked to the emotional stress. So what should be the emotion, based on that they will draw. Next is the expressive technique. So first is play technique, so common with the very much children, like you use dolls, puppets, etc. Role playing or the psychodrama. So individuals, they act out in the role in an imaginary way, like situations or revealing internal conflict. And next is the art therapy. So drawing, painting or the sculpting using to uncover the emotional content. Now come to the advantage. So it can reveal the unconscious aspect of personality, useful in the clinical diagnosis or the therapy planning, and it's also helpful with the children or the individuals who cannot express the feelings variability, and also it encourages the free expression and then creativity. So what all are the disadvantages? First is low reliability as well as validity, which is results can be vary between the examiners. Next is subjectivity in interpretations, requires the expert training, then time consuming for administrating as well as the scoring. Next is the cultural bias. So some stimuli may not universally relevant, and next is not ideal for the large scale testing as well as objective comparison. Now come to the next question, that is classical conditioning. So classical conditioning is nothing but it is also type of a teaching learning, which is a organism or the learns to associate a previously mutual stimulus with a stimulus which is naturally produce a response. Means internally one response is there, through that how they are learning. So that definition is given by the classical learning. So this, after repeated the pairings of the same stimulus, what will happen, the neural or the neurology system of that particular object or the neutral stimulus stimulus alone can elicit this response. Means without response also or without stimulus also at the same time, your neutral system or neurology will give you a signal that this is the time for particular work. Okay, so it has first described by the Ivan Pavlov, a Russian physiologist in the early 20th century. So this examination has done by a dog. Okay, so what are the components? First is unconditional stimulus like US or the UCS. Next is an example like food for a dog. Next is a unconditional response like you are. Okay, so what is the example? Like salivation is response to food. Okay, next is a neutral stimulus or the NS. So what is the example? The sound of a bell before it's paired with a food. Next is a conditional stimulus or the CS. What is the example? Bell after repeated association with the food. Next is a conditioned response or the seer. So example, salivation in response to the bell. Next come to the important concept in classical conditioning. First is the acquisition. Okay, so the process of the learning is nothing but the association between the neutral stimulus and then unconditional stimulus. So what is the example? The dog is learning to associate the bell with a food. Next is the extinction. So this awakening as well as the eventual disappearance of that conditioned response if the conditional stimulus is repeatedly presented without the unconditional stimulus. Okay, so example, ringing the bell without the giving food repeatedly, so dog stops the salivations. Okay, so that is the extinction. Now come to the spontaneous recovery. So this reappearance of the conditional response after a period of extinction even without new learning trials. Okay, so next is a generalization. So generalization is nothing but the tendency to respond to stimuli that are similar to the unconditional stimulus. As example, a dog salivating to a tone similar in the original bell also. So that is the like concept of a classical conditioning. And last is a discrimination. So ability or the distinguish between the conditional stimulus as well as the other stimuli which has do not the signal of the unconditional stimulus. Okay, so example, the dog salivates to the original to bell but not to a completely different sound. Okay, so now come to the next, that is the attention. So what do you mean by the attention? So attention is nothing but this term, this attention is generally refers to the cognitive process for selectively concentrating on a specific object or a completely aspect of information while they are ignoring the other person's or other perceived information. So in the other words, you can see it is a mental focus on the certain stimuli, thought or task, and also it's allowing an individual for processing the informations more effectively. Okay, so what is the psychological definition? It is a behavioral as well as the cognitive process of selectively focusing on one aspect of the environment while they are ignoring the other things. Now come to the frustration. So what do you mean by the frustration? In the psychology, frustration it is defined as an the emotional state which is mainly arise when the individual they are prevented from the achieving a goal or sustaining themselves as a need. So it occurs when there is a blockage or the obstacle, an internal like fear or lack of skills, or the external like social restrictions or the environmental barriers, so which is mainly interfere with the desired outcome. Okay, so the id. Next is the id. So what do you mean by the id? Id is nothing but it is the three components of a personality based on the sigmoid Freud psychoanalytic theory. Okay, so it is mainly represent the innate. Next is the instinctual part of the mind which is contains our basic drives as well as the desire such as a hunger, thirst, sex as well as the aggressions. Okay, so this id which is operates entirely in the unconscious mind as well as it follows the pleasure principle, meaning it seeks the immediate gratifications of its urges without considering of reality, logic as well as the social rules. So that is the id. So id is nothing but it is a combination of a three component. First is personality, next one is the instinctual part of the mind, and next is the innate. Okay, so these all are the three components which is mainly in depth with the id. So what is the component part of Freud's structural model of the personality? Id, ego and then superego. Okay, so id is a basic. Next come to the ego. So if your id is not so satisfied, so that time your id will convert into the ego, and sometimes what is happen if your ego is also not satisfied, so that time it's converted as a superego. Okay, so what is the function? It is a source of a basic instinctual drives and then impulses. What are the principles? First, pleasure, the principle 6, immediate satisfaction, and consciousness like a early unconscious. Now come to the short term memory. What do you mean by the short-term memory? So in the psychology, short-term memory is defined as the temporary shortest system in the brain which is mainly holds limited amount of information for a brief period of time. So usually it's around 20 to 30 seconds without rehearsal. So it is responsible for actively holding and then manipulating the information which is needed for the immediate task, such as remembering a phone number long enough to dial it or keeping track of items in a conversation. Okay, so that is the short term memory. So when your brain capacity or the holding capacity and then manipulating that particular informations into your memory, so that timing is reduced, so that time is called as a short term memory. So normally for the human being this timing is 20 to 30 seconds. Okay, so if you without any rehearsal, but if you are rehearsing properly or regularly, so that time what will happen, it will stay in your mind somehow or in your unconscious mind. But without rehearsal, if your brain can't able to hold that minimum 20 to 30 seconds, so that time it's called as a short term memory. So what are the characteristics? So limited capacity, like typically can hold maximum 7 plus minus 2 items, such as suggested as a George Miller. Okay, so brief duration is nothing but like information fades quickly unless they are actively rehearsed. Next is the active processing. So it can temporarily store and work with the information for reasoning, learning and then comprehension. Now come to the mental health. So what do you mean by the mental health? So mental health is nothing but it's also refers to emotional, psychological and social well-being. Okay, so it affects how the individuals they are thinking, the feeling and they are behaving in the daily life. And also this mental health is influencing the personal how they are handle their stress and how they relate to the others and then making the decisions. Okay, so sound mind is equal to sound body is equal to sound health, right? So if you are mentally not healthy, so obviously your body will be impacted for your psychological illness, and based on that you can't able to focus on your own goal. So this widely accepted definitions by the WHO is nothing but mental health is a state of well-being in which an individual realize their own abilities, can cope with the normal stresses of life, can work productively but fruitfully, and also it's able to make a contribution to their community. Now come to the psychological needs of the child. So what is the psychological needs? So children, they ensure the love, security and emotional support for developing the mentally as well as the emotionally well-being. So this include the affection, attention, encouragement and sense of a belonging. So which is mainly helping them for the build self-esteem as well as confidence and social skills. So what is the illusion? So mainly this in the psychological needs of child, based on the developing stage the psychological needs is also developing. Okay, so based on that, if any child is coming to the hospital and they're admitting, so based on their age group and based on their developmental status, as a nurse we have to behave it. Okay, so now come to the illusion. So what do you mean by the illusion? It's nothing but misinterpretations of a false interpretations of the reality. Okay, so it occurs when something appears differently from what is actually is. Suppose one stick is there but you are thinking it is as a tree, so that is called illusion. Okay, means the object is present but you are thinking that object in another way, so that is called illusion. So it's mainly affect the senses like sight as well as the hearing, or the mind like thoughts and beliefs. Okay, so that is the illusion. What is the hallucination? Hallucination is nothing but when you are misinterpreting something without any presence of any object, means that particular object is not at all present there but you are feeling like something is present there. Okay, so that is the illusion. Sometimes it happens due to the due to the light sightness or due to the vision problems or due to any other situations, and sometimes it's also happened due to the psychological issues. Okay, so that is the difference between illusion and hallucination. So illusion, object is there but you are misinterpreting that particular object to the another form, and in the hallucination the object should not be present but you are misinterpreting or you are misfeeling that there is some object is present. So that is the difference. Okay, now come to the next, that is types of illusion. First is a perceptual illusion. Perceptual illusion is nothing but when your senses are tricked. As example, seeing a mirage in the desert. Okay, next is a cognitive illusion. Cognitive illusion is nothing but when your mind is tricked often by the expectations or the beliefs. Example, believing a magician's trick is really real magic. Okay, now come to the clinical psychology. So what do you mean by the clinical psychology? That is also one of the branch of our psychological system which is a focus on the assessment assessment, diagnosis, treatment and prevention of mental health disorder as well as the psychological problems. Okay, so the clinical psychologists, they work with their individual, groups and then community for helping the manage the emotional, behavioral as well as the cognitive difficulties. Now come to the it interrogates with the scientific research as well as therapeutic practice, and also it addresses the issues ranging from common stress and anxiety to the until the severe mental illness like schizophrenia. Mental methods which is there including that is physiological testing, psychotherapy, counseling and then behavioral interventions. So the conscious definitions, what should be the conscious definition? Like clinical psychology, it is a scientific study and then professional practice which is aimed at understanding, preventing and then relieving the psychological distress and promoting the mental well-being. Now come to the IQ or intelligence quotient. So it is a numerical measures of person cognitive abilities to like in relations with their age group. So it is mainly designing for assess a variety of the mental functions. What are the including like reasoning ability, problem solving skills, logical thinking, understanding complex ideas and then learning speed. So typically this IQ, it is measured through the standardized test and then average score it set is 100. So scores over 100 indicates the above average intelligence, while score below 100 indicates the below average intelligence. Okay, so in the Asians, this IQ is a way to quantify the intellectual potential, but it does not capture all the aspect of intelligence such as the creativity, emotional intelligence as well as the practice skills. Now come to the next, that is attitude. So what do you mean by the attitude? So psychology, this attitude is defined as a psychological tendency which was expected by the evaluating a particular entity like person, object or ideas with some degree of favor or disfavor. So mainly it's generally considered as a three components, often called ABC model of attitude. A stands for affective component, which is feeling or emotions towards something like fear, love, etc. Next is the behavioral component. So this is a way of attitude which is influencing how we acting or behaving. And C stands for cognitive component. So belief, thought, knowledge about the object of the attitude. So example, like a person has a positive attitude towards exercise. So affective, they feel happy or motivated while thinking about exercise. Behavior, so they are regularly going to the gym or physical exercise, and cognitive, they believe exercise is good for health. Okay, so now come to the in short that attitude reflects a person's evaluation as well as tendency for responding a consistent way towards a particular thing. So now I will give you some more important questions for the exam. First, explain the roles of heredity and environment in shaping the human behavior and personality development. Then elaborate a Pavlov's classical conditioning theory and discuss its application in the nursing practice. Next, defining the learning. Explain the Skinner's operant conditioning theory, which is provides example of how you would use the reinforcement modality for modifying the patient's behavior. Next is define memory. Explain the classification or types of memory like sensory, short term, long term, and discuss the factors influencing memory. Then suggest methods for improving the memory. Next, define the attention. Discuss the determinants of the attention, internal and external factor. As a nurse, explain the steps you would take to minimize the distraction of a patient. Next is the define perception. Explain the principles of perceptual organization and describe common errors in the perception. Next, define the intelligence. So in this, describe the theories of intelligence like two-factor, multiple intelligence, etc. And also you have to elaborate on the uses of intelligence test in the healthcare settings. Next, define emotion. Explain the physiology of emotion and discuss any two theories of the emotion. As example, James Lang as well as a Cannonbird. And as a nurse, explain how you would help a patient to control their emotion. Next is define stress. Explain general adaptation syndrome or GAS theory for the stress, alarm resistance exertion stages, and the describe the various method of coping with the stress. Okay, last is define defense mechanism. Enumerate and explain any 10 defense mechanism with a suitable example for a clinical context. Okay, so these all are also much more important questions for your upcoming exam. So in this session I discussed so many important topics, as also I gave you a one important question set of paper. I hope you all understood my sessions. Again, we'll meet in next session. Till that, till learning and stay tuned with the easy nurse.